So picking up where we left off, we're still discussing, we began discussing hormones, primarily testosterone. So we're going to do a little bit of exercise physiology related to resistance training. So before I get into some points on this slide, you do have increases in peripheral blood concentrations of testosterone following both high intensity aerobic exercise as well as resistance training. So the focus is on resistance training. You do see some increases in testosterone, particularly in men following high-intensity aerobic exercise. However, what you don't typically see the muscle growth even in higher intensity aerobic exercises, and that's because, again, the primary adaptation you're looking at there is to allow for oxygen transport. So when we look at where we could kind of optimize the serum levels of testosterone regarding resistance training. So this is just some of the research that's out there. Again, there's other variables out there, and you will learn about some other options for this, but this is just kind of the guidelines I want you to know right now. Again, you see the best results, what we call large muscle group exercise. These are your, what we would classically think of as your bigger, like barbell type movements. So things like squatting, deadlifting, things of that nature. The resistance has to be fairly heavy. So you have to be looking at, something, typically, they show that between 85 and 95%. You want a moderate to high volume of exercises, so you want to be basically doing a lot of work. Shorter rest intervals, so keep the rest intervals to 30 seconds to 1 minute. And typically, individuals will get the best results from this after 2 or more years of resistance training experience. Another sort of important thing to know, anytime you're measuring hormone concentrations, there's what we call dineural variations. Basically what that means is that the hormones actually fluctuate throughout the day. So they may, testosterone, just like everything else, it may drop at certain points. So that's where it does get a little difficult to kind of measure this. But typically we look at these types of qualities related to the exercise producing increases in testosterone. So still looking at testosterone, just some things to be aware of. So there's free testosterone and sex hormone binding globulin. So whenever you hear about free testosterone, it's basically the unbound version that's circulating. So when you look at this, free testosterone accounts for only about 0.5% to 2% of the total testosterone. So basically total testosterone concentration just allows for more free testosterone. Again, here's another thing that is shown to increase free testosterone in both men and women. So heavy resistance exercise, six sets of 10 repetitions at 80% of 1 RM can actually increase free testosterone in men and women, although obviously the increases in women would be much smaller. And mostly because, again, particularly in younger men have more testosterone, more free testosterone than women have. So the same goes for the actual free testosterone. So if we look at the testosterone response in women, again, women have about 15 to 20-fold lower concentrations of circulating testosterone than men. The testosterone concentration can certainly vary. So you do have women that do secrete a higher level of adrenal androgens, so that will allow their testosterone to be higher. So, and as we had said, that's obviously the primary vehicle of testosterone in women is through the adrenal glands. So moving on and looking at some of the other anabolic hormones. So we have growth hormone. So growth hormone is a hormone that affects various tissues throughout the body. So it has a lot of target tissues. It targets bone, it targets skeletal muscle, fat cells, liver tissue. It's basically responsible for growth in the body. It's secreted by the anterior pituitary gland. So that's the gland that it comes from. And the diagram, which you don't have to drive yourself too crazy with, but it just kind of shows basically how like the hormone kind of interacts with the various things in the body. So definitely take a look at it. You could kind of see it obviously interacts with bone, it interacts with immune cells, it interacts with muscle, stimulating, protein accretion. If you look down here, They show some various modifying factors, which obviously exercise is one of the things we're going to look at, because it does play a role in adapting to stress and resistance training. So it is something important as you know, when you kind of look at resistance training and what has to go on with that, it's kind of an important marker for resistance training and being able to get some of the effects that you would get from lifting weights. So looking at growth hormone, so again, the main physiological roles of growth hormone and its superfamily or associated or the associated hormones with it. So it decreases glucose utilization and it decreases glycogen synthesis. You have an increase in protein synthesis. So the increase in protein synthesis would be one of those things that then supports an increase in muscle size. Same thing with increased amino acid transport across cells. That would be another thing that you see with growth hormone, and obviously the amino acid component is what assists with muscle hypertrophy. It increases the utilization of fatty acids. So, you know, you actually get decreased use of glucose for energy. So we know that we use glucose for energy in certain situations, though growth hormone can promote the use of fats for energy. Increases in collagen synthesis. So obviously this is something that again can relate back to increases in muscle size, and it can actually stimulate cartilage growth. Okay, so these are basically all things that growth hormone is going to do. So again, you need to be aware of these and understand that they are physiologic things that growth hormone will actually do in the body. So some other physiologic roles of growth hormone. So it increases the retention of nitrogen, sodium, potassium, and phosphorus. It enhances immune cell function. At the kidneys, it works to increase renal plasma flow and filtration. And it increases lipolysis. So we had seen that we talked about on the previous slide that you do increase the utilization of fatty acids for energy. So, and you also just increase general fat breakdown for energy. So growth hormone will actually promote the use of fats for energy and decrease the use of glycogen and glucose for energy. So with growth hormone, again, obviously we're looking at the responses to stress. So again, resistance training is a stress. So again, it'll respond to other forms of stress too, but resistance training is a form of stress. And this is basically what we're looking at here. So again, there's certain things that are going to influence this, and it's very similar to what we looked at with testosterone. So, you know, growth hormone release is going to be affected by the types of resistance training protocol used, including the duration of the rest period. So again, short rest periods tend to have a better hormone release than longer rest periods, even if you follow a similar total workload. However, it's not quite clear how like the various forms. So again, there's different types of growth hormones, or what they would call aggregates, and they're not quite sure how they're all individually affected, but we know for the most part that, again, short rest periods. So again, things like doing 3 sets of 10, so having kind of, again, more of that higher to moderate rep range with short, you know, 30 seconds to 1 minute rest intervals tends to be much more stimulative as far as producing increases in circulation in growth hormone. So as far as this looks, particularly at responses in women, so again, as I had mentioned in class, even so, you know, growth hormone is obviously going to be much more have a much greater influence on muscle hypertrophy in females than in males. However, there's a couple important things to note. So hormone concentrations and hormone responses can vary with the menstrual cycle. So women can actually have at some cases, have higher concentrations of growth hormone even than what men have throughout the menstrual cycle. And basically now, again, we don't know the mechanisms of this variation are unclear. So in other words, we don't quite know why the different phases of the menstrual cycle will impact this, but we're not exactly sure. Again, what we tend to find with this is, again, we tend to see the great increases again, as an example, 3 sets of 10. So again, kind of like that 10 rep range in and around there, with about 1 minute's rest seems to have the greatest impact in growth hormone in women. The biggest neuroendocrine difference from men appears to be reduced levels of testosterone and different resting level concentrations of other hormones. So that's what we kind of look at in as far as like the differences between men and women. Again, growth hormone will tend to be much more influential when we look at muscle growth in females. So when looking at growth hormone, just trying to kind of study it as far as training adaptations go, again, it is kind of, not to get too into the weeds with this, but it does get a little challenging. I think I mentioned this with testosterone, just because of the way hormones in general tend to fluctuate throughout the day. So in kind of looking at it, it appears that you kind of have to measure growth hormone concentrations over a long period of time to show whether or not changes do occur with resistance training. So again, you see here a 2 to 24 hour period to show, and there's different factors and there's also many factors that kind of mediate growth hormone adaptations. So there's some particular things that we look at, differences in the feedback mechanisms in the body. So again, the feedback mechanisms are there in the body to kind of keep the body at homeostasis, or having just basically everything functioning normal. So there's some slight differences with individuals with that. There's receptor sensitivities that you have to look at that are important. And there's another hormone that we're going to talk about, that one of the subtypes of growth hormone actually regulates another anabolic hormone that we're going to be talking about, insulin-like growth factor. So insulin-like growth factor also influences growth hormone. So they kind of play off each other. And then those dineural variations with the hormones, which we talked about before, kind of, those are just the changes over the course of the day. They also impact. So all of those things that I just discussed there kind of impact what goes on with training. So, when we look at the area underneath that 2 to 24 hour period, or underneath that time curve, there's so many pulsatile effects, or so many things that could influence the concentrations of growth hormone. So it does make it a little bit challenging to look at as far as that. Now again, as far as the training factors, that if we do have an effect, it is very similar to what we saw, and this is kind of a similar theme. Okay, so if we're looking at, well, what's the best way to, and we kind of already mentioned this, to influence growth hormone concentrations with training. Again, it's the similar, it's looking at about moderate to high repetitions, as heavy as you can go with that. Again, the bigger multi-joint lifts, short rest periods. They also say with this, and you can include this as well, making sure to get a carbohydrate and protein before and after workouts can also influence growth hormone. So another important anabolic hormone, and this will be the last of the anabolic hormones that we discuss, is your insulin-like growth factor. So insulin-like growth factor, and I mentioned this previously on the other slide, it kind of works with growth hormone, particularly the subtype of growth hormone that we kind of look at as far as influencing, muscle growth. So insulin-like growth factor, in addition to being an anabolic hormone, is just they typically look at this as a real important biomarker just for health in general. Again, this works with the growth hormone. This gets basically, secreted by the liver. So insulin-like growth factor is something that gets secreted by the liver. It's influenced by growth hormone. Testosterone also kind of interacts with insulin-like growth hormone a bit. So again, here, when we look at, again, training adaptations as far as how this impacted, again, multiple set, relatively heavy resistance, tends to influence this. This is another one, and I mentioned this with growth hormone, that they look at, and that's what this picture is actually showing. So they studied this regarding looking at nutritional supplementation, particularly with a protein carbohydrate, both before, during the 1 hour recovery period after a workout. And you see, if you look at the chart, that that's the mass fuel is basically the protein carbohydrate supplement that they used. They basically show that does impact insulin like growth hormone. So the idea being, in much what I talked about with growth hormone on the previous slide. So nutritional status does play a role with insulin like growth factor, much like it does with this. And again, the training, basically, again, the training protocols all the same. So that will be influenced by that as well. So the training adaptations of insulin-like growth factor, again, it's reflected by various mechanisms. So again, there's various things that influence it. So again, release, transport, receptor interaction. We had talked about receptor interaction with the other hormones as well. And again, it's going to basically interact with those other anabolic hormones. So interaction with them, we obviously can't be ignored, and they have obviously the same kind of target outcome. So again, insulin-like growth factor with growth hormone, and really testosterone you see influencing all of this as well. So again, those are going to be some key things to kind of keep in mind. Also, the influence of food. So again, the influence of, again, having that protein carbohydrate in and around training times will certainly help with that as well. And again, we still, like I said, as we've been saying, we still requires more investigation. Again, hormones are, as I said, kind of challenging to kind of look at as far as like how they interact with this. We know that, again, when we talk about the anabolic hormones, we know they're anabolic, but given the fact that, like, again, there's so many factors that influence them, that it does get a little challenging. But we know for the most part there is some interaction, obviously, that they do influence. And again, the training protocols that I discussed, and in particular with these last two hormones, the influence of food definitely plays a role. So now we look at kind of a different thing. So now we're actually looking at catabolic hormones. So obviously anabolic hormones will build muscle, catabolic hormones break down. And here we're looking at cortisol. So cortisol is a glucocorticoid. It's going to be secreted by the adrenal glands, more specifically the adrenal cortex. So you have the adrenal cortex, which is we're talking about here, will secrete cortisol. Then we also have the adrenal medulla, which will secrete some other hormones, which we'll be discussing in a bit. So cortisol is a catabolic hormone. Cortisol is essentially a stress hormone, okay, which when you strength train, it's a stress to the body. So the body is going to secrete cortisol when you strength train. So again, the idea is that you stress the body and then you recover. So it's this balance, and this is where things like, remember when we talked about overtraining, this is where you got to kind of balance things out, okay? And your body does need cortisol. Your body has to be able to respond to stress with it by doing that. So when we look at like what exactly increases, or what cortisol actually does, so it stimulates the conversion of amino acids to carbohydrates, and increases the level of proteolytic enzymes. So basically what this is saying is it's going to, in particular, when you don't have enough carbohydrates. So this is part of the reason why, if you're trying to build muscle, it is important to take in carbohydrates, because what's going to happen is cortisol is going to look to break down amino acids and proteins for energy, which obviously amino acids and protein are what you're trying to use to build the muscle. So that's going to be something that's important there, and that's part of the reason why, again, individuals looking to build muscle need to make sure that their nutrition is appropriate. It also inhibits protein synthesis and suppresses a lot of the glucose-dependent functions, such as glycogenesis and immune cell function. So cortisol in increasing amounts will suppress the immune system. Now, during times of injury and disease, you are going to have an increase in cortisol, obviously, because that's stress to the body. So that's why when you do get, sick or in a disease state, your body will break down proteins and you will experience muscle atrophy. What we obviously look to do is we look to counteract this, hopefully, through training and nutrition with the anabolic hormones. So again, that's why it's important for recovery and why it's important to also make sure to get appropriate nutrition, because otherwise cortisol will take over and then you're not going to be building muscle, and in most cases you'll actually be losing some. The other thing just some other things to note, cortisol has a greater effect if we're talking about breaking down proteins. It actually does have a greater effect on type 2 fibers, which is also relevant because, again, those are the fibers that, do tend to have a greater propensity for hypertrophy. So that's something to note as well. And the other thing we do in general for everybody, under normal conditions, cortisol's highest early in the day, so we always talked about the binaural variations with all the hormones. What we do know about cortisol is that it's highest early in the morning. So if when you wake up, when you first get out of bed, your cortisol is actually at its highest, or at least where it should be. And ideally, over the course of the day, your cortisol levels should actually drop. So again, so here we're going to tie it into resistance training responses again. It responds to resistance exercise that creates a dramatic stimulus for anaerobic metabolism. So that's basically what we're going to be looking at here. Again, very similar to the other types that we've talked about in the past. So what we look at this is, again, we get worried. We're like, well, geez, if we're going to increase cortisol, isn't that going to affect our level to grow muscle? Again, our body does need to secrete cortisol to have a normal stress response. So it doesn't have negative effects. Again, the adaptation, if again, of course, this also requires all the other things we've talked about before, but the adaptation that individuals can experience, as long as they're recovering appropriately and they're getting appropriate nutrition, is that you can actually disinhibit cortisol, particularly for men at the level of the testes, and that allows testosterone to still improve its effects. So we want to make sure that the acute increases are fine. What we don't want to have are chronically elevated levels of cortisol, which you'd see somebody in an overtrained state. So you wouldn't want that. The other thing we do have to look at are the immune responses. So the B cells and T cells, which are white cells in the immune system, the immune system does get suppressed after intense exercise, which again is kind of a normal response. So again, those resistance training protocols that we talked about, that's kind of going to be a normal response. So after an intense workout, your immune system is suppressed. However, as long as you do not have chronically highly elevated levels of cortisol, you're not going to have that. So the good thing about the acute increases is that that's going to contribute to the muscle tissue response in a positive sense. So think of the acute cortisol release as having a positive effect, but what you don't want to have are chronically elevated levels of cortisol. So it's still considered catabolic, okay? So I want to be clear on that. However, the catabolic effects that it's going to exert is going to be what allows for the adaptation, as long as you have appropriate recovery and nutrition. Then the other hormones, so the catecholamines, and the catecholamines, and primarily what we're looking at here are epinephrine and norepinephrine, classically also referred to as adrenaline and noradrenaline. These are going to be secreted from the adrenal medulla, okay? So what we look at here with these, again, these are typically going to be more catabolic in nature. However, again, they're going to be helpful and they have specific roles. So the roles here for epinephrine, norepinephrine, increase force production, particularly via central mechanisms and also through metabolic activity, increase muscle contraction rate, increase in blood pressure, they increase energy availability. So again, if even for somebody that's not as versed in like anatomy and physiology, they understand what the idea of adrenaline is. Okay, or you talk about an adrenaline rush and what it does. Well, that's effectively epinephrine and norepinephrine and what they effectively do. They increase muscle blood flow, and they augment secretion rates of other hormones. So there's an interaction here with testosterone with these adrenal hormones. So they do augment other hormones that are anabolic in the case of testosterone. So again, epinephrine, norepinephrine, we look at being in as far as basically being able to, what epinephrine, norepinephrine do are going to basically be the energy responses that you need for a workout. Okay. And again, they're gonna reflect the acute demands of kind of that high intensity, short rest interval workout, which we've been basically correlating to everything else. So this is where it's going to be, kind of important in looking at, how we kind of look at, again, designing training programs, particularly as it relates to muscle hypertrophy and strength. So again, the training adaptations for the catecholamines, again, heavy resistance training is shown to increase the ability of individuals to secrete greater amounts during maximal exercise. Again, because epinephrine is involved in metabolic control and force production. So think of epinephrine, norepinephrine as being the things that kind of help our body to actually basically give it the drive or the need to complete the workout. So it allows for, muscle contraction force. It allows our cardiovascular system to get blood flow to the muscles. Those are some of the things it does. The other thing it's going to do in interaction with those other anabolic hormones is going to be what allows those. So the catecholamines interact with them pretty closely when we look at what goes on with the hormone release as a result of exercise. And the manipulation of endocrine system summary. So this could be something, and I've mentioned this time and time again. You've probably gotten sick of hearing me say it as far as the resistance training protocol. So I did take this. If you go to page 85 in your book, which is not a chapter that we covered, but it's basically the chapter I got all of this hormone information from. There's a little table that talks about the manipulation of the endocrine system. So it's titled, How Can Athletes Manipulate the Endocrine System with Resistance Training? It kind of gives a nice little summary. Again, for the most part, it talks about everything I said, but, for those of you that kind of like, look at like a summary of the information, it does provide a nice little summary about, what type of resistance training protocols you should use, which again, for the most part, they're all the same. They talk about testosterone, they talk about growth hormone, and they talk about the adrenal hormones there. So take a look at those. And again, from the standpoint of hormones, that's what I want you to know. So those anabolic hormones and the adrenal hormones, and just make sure that you know kind of how they operate within the context of resistance training adaptations. So kind of getting us back to some just more practically applied stuff. So I did take this out of the book as well. These are just some examples. And again, there's many other split routines out there. So that's always one of the big things everybody wants to talk about is, what's the best type of, regardless whether you're talking bodybuilding, sports training, powerlifting, what's the best split or what's the best way to train muscles over the course of the week. Here's a table just showing some examples. So if you're looking at this, if you look up here, this is actually typically the way, this top row up here is typically the way I structure most of my programs for athletes is lower body and upper body. Down here you kind of see a little bit of a different split. Chest, shoulders, triceps, lower body, back, biceps, triceps, and then they repeat this. This is a five days per week. And then here you see another split down here, chest and back, lower body. This is a 6 time per week split. There's various ways you can do this. Typically, for most people, it is best to train a muscle group twice a week. Okay. So to really get, and that's for most people. Now, are there individuals that train muscle groups once a week and still get benefits from that? Yes. But it's volume dependent, okay? most people won't fit enough volume or get enough good volume out of training a muscle group once a week. Okay. Then when you're starting to talk about athletes, just to be able to maintain strength, okay, so this just looks at the workout week in general. You typically need about 2 training days a week to retain strength. So in other words, if you're an athlete and you're in season, it's good to at least do a maintenance routine of at least 2 days a week. If you are really in a jam, you can get away with 1 day a week. I've always tried in most instances to get athletes in season to lift at least twice a week. And you could keep the volume pretty minimal for that because they're so active with practices in their sport. But 2 days a week tends to be the best option there. So training load and restoration time. So these are just some guidelines in as far as what you have to look as far as recovery. Okay. So these look at the training load, and I'm just going to put all these up here. And again, you can be pausing this and stuff like that if you need to kind of slow down or you need to take a minute to write something down. So, that's the advantage to watching a video is you can pause, rewatch, so on and so forth. But these just look at like the training load and how much time is needed for a recovery. So extreme workouts, 72 hours, large. Then you see substantial, medium, small. I kind of just want you to know this. It's you say, well, what's the difference between extreme and large? Again, it is kind of a gray area, but these are kind of the reference time frames. The other thing you could look at, and this is the last point on here, with individual muscle groups. So this is the other thing that does make training a little more complex, and sometimes you have to experiment with stuff. Individual muscle groups don't all recover the same way. Larger muscle groups, things like the quadriceps, the hamstrings, the back muscles, they actually require, just from a tissue recovery standpoint, typically a longer period of time. So think 48 hours or more for larger muscle groups. For intermediate size muscle groups, they could recover as quickly as 24 hours, and then small muscle groups can actually recover in less time. They can actually recover in less than 12 hours. So like an example of those would be like the muscles, like if you were training your forearm muscles, they recover very quickly. You could just about train them almost every day and still see growth and recovery in those because they're so small. They tend to recover fairly fast. So when you're looking at recovery time, you have to look at just the workout in general, and you have to kind of look at the muscle groups involved. So for exercise order, this is going to be classically what we look at. So when you're designing a routine, okay, this is kind of your base framework. Now, again, just like you'll see, there are exceptions to everything, but I would say for particularly for people who are new to training, this is what you typically look at. You typically want to use your large multi-joint exercises first, okay? So that's when you're the most fresh. These are the exercises that kind of take the most out of you. So for most people, again, there are exceptions to this. We're kind of just staying, with some basic information for now. This is what you'd want to do first. And the vast majority of the programs that I've written and that you will write in the future will involve that. Always train power first. So again, when you're looking for that speed of contraction, so if you are going to say include the Olympic lifts, which we're going to talk about in this discussion, those you would typically train first and then maybe next go to things like the squat and bench press. So that's what you would kind of do as far as that. Larger muscle groups before smaller. Again, getting to train them fresh. And again, as I said, there are techniques and philosophies that do justify a change in the order. But typically especially for individuals first starting out, or even if we look at early in the off season for an athlete, even if they have some experience, this is kind of your base framework. You will see, for instance, there are times where individuals will train smaller muscle groups first, or may do a power exercise after something done more for more strength and force production. Those are kind of a little bit more for like intermediate advanced people, and you're not going to do that kind of stuff all the time. So this is kind of where we'll start with the exercise order and kind of how you design things. So just something of note, and I kind of mentioned this in class, you are going to be responsible for just knowing basic exercises and muscle groups. So in the text on pages 358 to 406 is kind of the various muscles and muscle groups. Now I'm going to give a little summary in some ways that could kind of make it a little easier for you to note. So on the next slide, I'm going to kind of go through that and sort of discuss some of the context for which you can kind of remember some of the muscle groups, but use those pages as a way to kind of complement that information. So here's a good way to kind of classify things based on anatomy. And again, I still want you to go back and kind of look at those exercises individually. So think of like all of your pushing exercises, the variations of the bench press, dumbbell presses, things like that. Those particular exercises all focus on the pushing or the pressing muscles. So the pectoralis major, the deltoids, the triceps, okay? So that would be influenced by all the pushing or pressing. So any motion where you're pushing weight away, pressing weight, deltoids, pectoralis major, triceps. Then you have pulling muscles, okay? So here, and we're strictly looking at upper body, okay? So you'll hear of bodybuilders maybe doing a deadlift on their pull day. We're gonna count the deadlift as primarily a lower body exercise for our purposes. So the pulling exercises we're talking about here, we're talking about upper body pulling, okay? Latissimus dorsi, your trapezius muscles, your rhomboids, your biceps, okay? So be thinking things like obviously the lat pull down, any type of row variation, okay? Any exercise where you're pulling weight towards you, okay? Now, the way we'll look at lower body are the muscles in the hip and thigh. So two categories here, primarily hip and knee extension and just primarily hip extension, okay? So for instance, the squat exercise would be hip and knee extension because you work through large range of motions at both the hip and the knee. A step up, lunges, split squats, or the famous Bulgarian split squat that everybody hates doing, okay? Those would be hip and knee extension movements. That's as opposed to hip extension movements where there's minimal to no movement at the knee, okay? So that would be like the deadlift, stiff-legged deadlifts, Romanian deadlifts, which really are the same thing as stiff-legged deadlifts, the good morning exercise, things like that. Those would be exercises that primarily work the hip extension, which really just looks at more the glutes and the hamstrings, not so much the quadriceps, okay? Whereas when you have hip and knee extension, you get a much larger amplitude and range of motion at the knee. Obviously, you have single joint exercises for the lower body as well. A knee extension will work the quadriceps. Any sort of just hip extension will work the glutes. Any sort of knee flexion will work the hamstrings, okay? Then you have the total body power exercises, which I have some videos on. And I want you to know, so for the power exercises, as your textbook refers them to, or the Olympic lifts, make sure that you know the phases. So make sure you know the phases of the snatch and clean, and make sure you know the difference between the push press and the push jerk. But those are total body exercises that you can use. And again, there's other single joint exercises in the upper body. Again, they're not obviously very complex. A tricep press down works the triceps, a bicep curl, anything where you're just flexing the elbow is going to be working the elbow flexors. So, but again, this in conjunction with kind of going through those pages will kind of give you a basic idea in as far as like anatomically what muscles are working and things of that nature. So here's a video if you watch this. So the clean is going to be something that we're going to be working on in class. So here just kind of shows the phases of the clean. If we watch this video, sorry, there's a commercial which we'll skip. Trying to skip, it's not working.
Not what you expected? When the unexpected happens to your business, NJM will go above and beyond for you. For over a century, NJM has been there when you need us most. NJM, more than you'd expect from business insurance. Hoffman, about the Ludwig case. Yes, sir, Mr. Hoffman. 1 second. What is that? Tracking every second of my day, sir. Is this what everyone does? No. Hop is using sticky notes. It's time for practice, Panther. I love having the auto correction bullets with my MiniMed 780G system. I've always watched my sugar level.
All right, so what I'm going to do is I think the clean video played all the way through. I skipped it. I'm going to post the videos as a separate link. I was having a little trouble getting them to play on this video here. This looks at, I'll be able to play this. I'm going to try to play this one through, but I'll also post a link to it as well. So what we look at here is this is what's called a push press. So you have the clean and the snatch. The push press, what that does is the difference between the push press and the push jerk. When we look at the catch phase, the difference between those two is during the catch phase. The catch phase in the push press, they're fully extended, as opposed to the jerk, which you would see when in actual Olympic weightlifting competitions they do the clean and jerk. When you fully extend, when you're in the catch for the jerk, your knees are actually flexed. Okay, so if you watch this, I'm sure there'll be a commercial.
So, what are you gonna ask the wizard for, Pixel? Well, I'm not sure he's such a... Oh, I want him to give me all the magical AI stuff he's given you. But the wizard didn't give me, like how you come with Gemini Live to have free-flowing conversations about almost anything. I didn't get that from the wizard or Pixel Studio. The wizard is... Oh, and I want Circle to search. iPhone, just imagine if you and I both had your magic. So, what are you...
All right, so I'm just going to skip the video. I'll post those videos online. You could look at them, but again, you could also follow that in the textbook as well. So sorry about the little technical glitch there. As I said, the push jerk, which you could actually see it. I don't even have to play the video here. You can actually see. So the difference between the push press and the push jerk, this is actually the catch position if you're just looking at this picture right here. So, and then you stand up with it. Whereas in the push press, you would actually forcefully extend, and you would end with the catch phase in extension. So that's the difference between those two particular those exercises. As I said, I'll post separate links if you want to watch those videos. I think it's helpful to see, and you could kind of look at and find that those Olympic lift videos that are in slow motion are kind of really nice to see, because you can really break down the phases when you look at them. So as far as resistance training frequency, again, based on the season, so this just looks at how many workouts a week, not particularly how many times you're working on a muscle group. So based on the season, so off season, anywhere from 3 to 6 days per week can work for off season strength training. Preseason, 3 to 4. So preseason would be basically where you're starting more structured sport practices. So off season is all dedicated towards general training. Preseason is going to be a little bit more dedicated towards start to be a little bit more dedicated towards skill enhancement in the sport. In season, you can do anywhere from 1 to 3. 2 is always, like, as I said, that's usually the good spot to shoot for. Some weeks, I know with like some athletes, I remember particularly starters in seasons where there's multiple games during a week. Sometimes I would tell, for instance, like starters, hey, this week only do one of the workouts, just because of the fact they're getting more playing time. Whereas, some individuals that aren't playing as much, they could maybe even go to 3 days a week, which you can also look at as well. Then postseason, when you're in the active rest once the season's over, it could be 0 to 3 days. So they may not do any strength training. They may take a week or two completely off, or maybe even longer. But that would be during an act. That would be more or less an active rest phase once the season ends. So these are your learning outcomes, again, which is also effectively your review, if you will. So these are all the things that we looked at. So again, if you take this list and you kind of know what kind of falls underneath that, it kind of tells you everything you need to know. I apologize that the exercise videos did not come out and they were kind of annoying. I have to troubleshoot how to not have maybe the commercials play, because that gets a little rough to go through. But I'll find the links to those videos so that if you want to watch and actually get to see them get done, you'll be able to.